Hello. So well, I've missed a few lives, but I am still trying to show up. My name is Dr. Mkono, and I'm going to do a brief teaching today on asthma and COPD and how to survive and what I think any person who has been diagnosed with this or is being evaluated for asthma or COPD, they should know. You may hear the background, which is my son going wild. But hopefully you can still hear me and understand what I'm saying. I want you to know that asthma, COPD, they're very similar. They're not the same, but they're very similar in the setup of how we treat asthma and COPD. I want you to know that if you understand your inhalers and how they work for you and suppressing a flare and suppressing the irritability of your lungs, then this is going to help you do better. I think that if you understand your schedule of your inhaler, you can pretty much know that you're going to get the best out of that inhaler at that particular dose if you get the schedule right. And if you don't get the schedule right, then it ultimately means that your asthma is not going to have the full suppression from that inhaler. And therefore, when people escalate that inhaler dosing, or when your doctor says, no, we're going to have to use a different inhaler, if that inhaler is shaped the same or using the same schedule or similar, you're still not going to get the best effect if you're not consistent and if you don't know how to use that inhaler either. Suppression is key in trying to control your breathing, allowing you to live more predictably. And I mean, when you get hospitalized, hopefully it will never happen, but if it does happen, sometimes it's good for you to look back and say, what could I have done differently? Most of the time you caught a cold. Yes, you can do things differently with the cold too. You can try to minimize how many exposures of people who are sick. We all do that, right? We are conscious, hey, you are sick, please stay away from me. And for those people who are not sick, and maybe it's weather, maybe it is living in a dusty environment, keep your air very pure, very clean, reduce the carpeting, make sure that you do not have the filters that are not made for you. Obviously, air filters are very important, and that's what's important, that you understand what you're supposed to do with your inhalers, with your whole setup at home, your nebulizers. If you have a nebulizer at home, it's because your doctor feels you probably need one. And if you don't know if you need one, it's because if you've had a nebulizer before, either in the ER, in the urgent care, maybe one time last year you had a cold and they gave you a nebulizer, it's important to tell your doctor, you know what, I think it would be good for me to have a nebulizer at home. There's nothing wrong with you asking your provider for a nebulizer machine. Because when you're well, we're obviously not going to suggest that you use one. But when you're sick, we definitely may have to escalate in giving you a nebulizer. And why do we do that? Because at that point, your inhalers, your nebulizers are not able to reach your lungs. You're not able to breathe and hold that breath for 10 seconds. And therefore, we give you a nebulizer to make it easier for you to get the delivery to your lungs. So the most important thing that you should know as an asthmatic or as a COPD patient, that your lungs, once they start getting irritated, they have a higher chance of escalating themselves. And therefore, the faster you suppress them, the more likely that you're going to get a way to maybe avoid a flare-up that lands you like it maybe did before to the emergency room or to the urgent care or to that doctor appointment that you didn't plan. So who should you reach out to? Your primary doctor. If you have a pulmonologist, you reach out to the pulmonologist. The earlier the better, because then they can line up everything early, and hopefully they got you in gear 1 versus getting you in gear 10. In gear 10, even if you get your pulmonologist on board, they're probably going to tell you, hey,
you need to go to the ER, because at that point things have gone haywire and they are just in a big storm and your lungs are working against you. You can't even take a breath to take your inhaler. They're not going to send you home. They're going to send you to the ER. They're going to send you to urgent care, and it's costly. So I want to say, the earlier that you're tuned into saying, this is not like my lungs when they're settled, this means something is coming. And it could be as early as, I never use a rescue, and all of a sudden you're using the rescue. So it's very important that these tips stay in mind. Like, you think of it. If you're traveling, you go with all your medications that you take normally when you have a flare, because just in case you do have a change in weather or something happens on the other end, you have everything you need for an emergency setup. And if it's an emergency where you really can't catch your breath, then even the rescue may not be the right idea. Sometimes you need to be calling 911 as you're going to get the rescue medication. So again, my name is Dr. Mkono, and I just wanted to share the tip of making sure you understand what you're supposed to do with your inhalers. That is something I discuss all the time. Your proper technique is very important. It helps you because it saves you the heartache of discovering later that if you use your inhaler properly and consistently, especially the maintenance, it will save you a flare that lands you to the hospital. So it's cheaper for you to know how to use your inhaler. It's cheaper for you to know how to learn the early signs of trouble: wheezing, tightness, shortness of breath. Waking up at night, you're needing your nebulizer, you're needing your rescue. It means your lungs are disturbed. And if they're disturbed, they're gonna flare and they're gonna invite secretions and phlegm. And then your lungs will really be difficult to breathe because you're full of congestion. They have no room to take in air, clean air, and expelling the air is also a problem because they're congested. They're not working effectively to get you breathing better. So again, my name is Dr. Mkono, and I just want to give you that tip that, you have all the clues. Your body gives you the clues of flare. It gives you the consistent knocking, like something is not right. You just want to pay attention to that and follow through with reaching out to your doctor. The sooner the better, so that they can attend to you early and improve the success rate and reduce the chances of you being in the hospital, in urgent care, or otherwise. And if this tip is important to you, it could also be important in the future. So make sure you save it in case you need to hear it later. If you were hospitalized, then this tip is also important because it is a good time to reassess what was your plan before hospitalization or before urgent care or before the flare. Were you consistent with your inhalers that were meant to be used twice a day? If you were not, this is time to do that. It's time to reach out to your doctors, get your refills, and always have what you're supposed to take. And if it's not working, if you've been using everything and you still feel like your lungs are not settled, talking to your provider, letting him know or her know that you're using everything as prescribed, but despite all that, you're not breathing good. And this is a good time for them to check you, put you on the spot, tell you, put your inhaler in your hand, just like I have mine, and say, hey, this is your inhaler, show me. And you were gonna shake it. Hopefully you're gonna prime it and say, yes, it's primed. Shake it again and make sure that obviously you have enough. You've checked the meter, right, is over here, right? For this particular inhaler, you shake it and then you go, and then and you know that your doctor is going to say, oh, perfect, you're doing it right. And if you happen to not know what you're doing and you're one of those who says, oh, well, one puff is one puff. No, this is not a puff. That's not a puff. You actually exhaled everything, and that may be the reason why you keep flaring. So they should cross-check you and check you multiple times in understanding whether your technique is good or whether you're expelling all the medication out in the air. This is very important, and that is why I stress, know your inhaler. There are many types of inhalers with different type of combinations inside, with different schedules. Some are once a day, then they should be used once a day. Some are twice a day, then they should be used twice a day. Some are 2 puffs twice a day. Some are 1 puff twice a day. Some are nebulized. Some are, people are using spacers to optimize themselves and making sure that you know what steps you need to take when your inhaler is not reaching your lungs properly. Remember to rinse your mouth after some of these inhalers. If you don't remember which one, rinse after all. And again, my name is Dr. Mkono, and I just want to make sure that you guys are on top of your lungs and you know the telltale signs of trouble. Rescue inhaler excessively on top of your maintenance inhaler is usually a very good clue that something is coming your way, like a flare or infection, or maybe you have a pneumonia. Somebody needs to assess you. Somebody needs to get a hold of you way before everything kind of escalates into a level that can only be suppressed in an urgent care or ER. And that is costly. So the earlier you know, the better. And the quicker you know what to have at home, the better for you, so you can start applying things at home. But please be careful that if your lungs are telling you you're not able to catch your breath, then it's better and safer that you go and seek care. The earlier, the better. Again, this is Dr. Mkono, not giving medical advice, just educating you. And hopefully you picked up a tip or two today. And if not, check out the lives, check out the videos that I have, and there's plenty. Look me up on YouTube or look me up on TikTok. I have plenty of videos everywhere sharing all the tips related to asthma and the simple tips that make the biggest difference in how you breathe and how you live your life less interrupted with inhalers, basic inhalers. A lot of you already have everything you need at home. You just haven't applied them properly. You haven't even given it a thought. Nobody took the time to teach you your inhaler, and you're using it the wrong way the whole time and you didn't know. So this is why I'm here to actually make sure that it's something that we air out right now. Inhalers are not so simple, especially if your lungs are not well. They're not that simple. Just go ahead and take a look, open mind, and look at every tip I give, including holding that breath with your inhaler when you can. And of course, your lungs have to be compliant. They cannot be in an asthma attack. They cannot be in a flare, and then you're trying to treat them in that state. They should really be calm. And if they're not calm, you need to make sure that your doctors have helped you calm your lungs to the normal state that they should be. And then you should be very, 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 very consistent with your rescue inhaler on the sideline, not as your primary source of help. Rescue is meant for rare occasion, not consistent every single day. And if you're doing that with your rescue, you need to figure out whether your maintenance inhaler plan is straight, because it's probably not straight. And it could be as simple as you're not applying it twice a day. It's scheduled twice a day. You're doing it once a day and you're not applying it well. The technique is off. Therefore, you're expelling the air. Then it wouldn't matter. If you're using your inhaler like this, it wouldn't matter if they went to the highest level and gave you 10 inhalers. It won't matter because you just expelled everything. Nebulizers, you will see it, but inhalers, you will not. Because when we do it right, just like I'm going to show you now, shake it, prime it for the first time that it's been used. For the maintenance, you will do it one time. And after that, you won't need to ever shake it again because you're going to be consistent with the maintenance. Rescue, you're going to keep shaking it because you're using it rarely and it needs to be woken up and used and activated, right? So shake it, you prime it, you make sure it's working, and then the next shake, exhale everything out, and then I'm going to say to you, if that's easy for you, then fabulous. But just remember, if it's 2 puffs, then you want to add the second puff, waiting maybe 30 seconds in between, shaking it up again. Always shake before. You don't always have to prime, but you do have to shake it, mix it up right before you apply it again. And you will do the same thing. And if that inhaler is not doing the job, you need to communicate with that doctor and say, you know what? I wake up at night, I can't catch my breath. I'm always in a flare. I'm always getting pneumonia. I'm wheezing. I'm tight. All those things are going to be something that you need to tell your doctor. They're not going to know. They're not magicians. You're going to have to let them know, I'm having a problem with my lungs. My lungs are interrupting me, constantly interrupting me. This means they need to be cared for in a different way. Your doctor can check your therapy, check your technique, check whether you are consistent. No, they can't check that. You're going to be able to check that. If you're using it once a month and it's supposed to be twice a day, you're going to be the one who's going to check that. And then don't expect something that is used twice a month and is supposed to be used twice a day to work for you, because it won't. And that is why, it won't work. And I just want you guys to know that some of it is a doctor problem, but a lot of it lately, when I'm teaching and watching and checking on my patients, it is absolutely a patient problem. And you have to make both the doctor and patient problem settled, so that way you can get the best effect on it, okay? So I'm only saying to you that an inhaler is only gonna work as long as the patient has been instructed properly. So this is what I'm trying to do. Instruct you, reorient you so that you got it right. So the technique is right. That's prescription needs to be right too. Of course it needs to be right. If the doctor gives you the wrong inhaler for the wrong problem, it's not gonna be right. So let's just say your doctor got it right and they taught you how to use the inhaler and you're applying it on the schedule they gave you. So the doctor told you twice a day. You're doing it once a month. It's not gonna work. Or twice a day and you said, you know what? I'm just gonna do it once a day. They are once a day inhalers and they are twice a day inhaler, and they are very different. You need to make sure that you're using your prescribed inhaler the way it's prescribed. Make sure that there is no confusion on that, because if there is, when the doctor follows you up, they're gonna assume their prescription is correct and you are not better. So they're gonna add. Unless you tell them, no doctor, I haven't even started, or no doctor, I'm doing it how I feel. Then you're gonna be on two different pages, and you can see how quickly that can get very confusing and it will land you in a hospital, urgent care, with pneumonia, etc. Why pneumonia? Because phlegm just plugs up. Asthma makes a lot of phlegm. COPD also makes a lot of phlegm. And when bacteria finds that phlegm, it loves it. There's no reason why bacteria won't land on an asthmatic lung and a COPD lung untreated and find that environment the best and grow there and invite more. And bacteria, you can invite 20, 30. There's plenty of room to have 100 variations of infections. Why? Because they have plenty of food and they will grow, and they will cause disturbances to you. Pneumonia, destruction of your lung over time. And that is all related to asthma, COPD, poorly controlled. When you control them though, you dry up that phlegm and there's less likely an infection. Yes, we all get infection, but you get less than the ones you were getting every day, every other day. Bronchitis, pneumonia, antibiotic steroids over and over again. Bronchitis is your last name. That's not how it's supposed to be. You need to figure out, am I doing what I'm supposed to do with my inhalers? Did they prescribe them and I'm using them as decoration? Did they prescribe them and I haven't picked them up? And I'm expecting my doctor to miraculously make me better by just looking at me. It doesn't work like that. So I need you to know. I said hi, I did. Can you make sure that your doctor and yourself have the right plan that works out for you? So I really, really wish that all of you who will see this live, you get a benefit of understanding asthma, COPD, both of them. They have telltale signs. They give you warnings most of the time very early, and you want to make sure that you focus on those things very, very seriously. So if you have a question for asthma or COPD, you can ask me, but if you don't, then this is probably not the right place for you. But I am going to be posting this live later, and you can definitely look it up and see if this is something that you're interested in learning more about asthma and COPD, the tips. And yes, please, please, please share and invite people who you think needs this sort of help. Make sure that you follow up with your doctors. I'm not trying to replace them. I'm a pulmonologist and I have my own set of patients, and even them, when they show up here, we're going to still guide them to go and get care from me in my office so that it's actually individualized to them. I wish you all the best, and I hope that you do well in whatever state of asthma you have or COPD. And if you don't know, then you can at least have a starting place of what to do in your next flare or before your next flare. Hopefully we can prevent a few mishaps related to not using your inhalers consistently. I wish you all the best, and again, good night. I hope you have a